decided that I want to get away from the formalities, and I want to just talk real about the things that I've experienced and the things that I'm understanding about this. One of the things that I do want to, before I go too far into my own realness, I wanted to elaborate something very important that she talked about. One is, and you asked about it, about covered California. The Affordable Care Act, as you know, is sometimes affectionately called Obamacare. And then, of course, the official name is actually truncated to Affordable Care Act. It's very, very important as leaders in our community that we start saying covered California. Because in California, that is the name of the Affordable Care Act. And what I found, just through my communication with people in the community and just through my casual conversations, when I ask people if they heard of covered California, they say no. And of course, if I say, have they heard of Obamacare, of course they say yes. Well, in the advertisement that you're starting to hear on television and radio and in the news, it's going to be called Covered California. And so the danger is that a lot of members in our community are going to miss it because they won't hear Obamacare. They will hear Covered California and won't know that that's what they're talking about. So it's very, very important you in your daily lives, you talk about to your family, to your friends, and to your relatives and everybody else, Covered California. Find out, ask them. If you heard of Covered California, you need to know about that. It's the Affordable Care Act, and if that doesn't ring a bell to them, they'll say that's Obamacare and that's for you. One of the things that I get a chance to be engaged in, of course, particularly in the context of using the terminology of Obamacare, is the politics. And as you all saw last week, it can get real serious and real deep. One of the things that I talk to people, and I run into people that look like me, that say that, well, I don't want Obamacare. And so I asked them, I try to turn the conversation to, this act is about access to affordable health care for you and your family. Now let's talk again. Are you interested in access to affordable quality care for you and your family? And most often people say, well, of course. Well, then you need to hear the information about the Affordable Care Act or Covered California. The other thing that I want to mention before I get, because my intent here really was to make you sick. And so I'm going to get a little into that. I want to make you sick because people really understand what I mean by access to a quality, affordable care that's for you and your family when I make you sick. But before I do that, I also, she had some websites on there. I wanted to add another one if you wrote those down, and that is coveredca.com. That is the official website that people can go to register themselves. Of course, there's individuals throughout our community that are, you guys are that position, what is it called? Certified enrollment counselors. Yeah. I trained certified enrollment counselors, I don't even know what they are. But in our communities, there's a number of certified enrollment counselors that can help individuals and guide them through the enrollment process. But we all need to know the website, coveredca.com. Of course, like anything else, there's going to be a lot of bogus things out there. For example, coveredcalifornia.com. That is not Covered CA. That is not Covered California's website. So we also have to be on the lookout for things that are not. We have to be on the lookout for people that want to sell you on their insurance agents that want to sell you on a number of other products that are not Covered California. So as leaders, and I'm speaking to leaders here in this group here. As leaders in our community, we have to be on the lookout for those kinds of things and of course alert our brothers and sisters. Okay, so let me make you sick a little bit. So we were talking about affordable care. So I wanted to bring, for example, let's talk about cancer. And most of us in our community have had some exposure to someone in our family or someone we know, someone we love that has had cancer and that have passed away from cancer. African American men were 1.7 times as likely to have new cases of stomach cancer as non-Hispanic white men. Okay? We're getting this more than anyone else. In fact, the death rate for cancer among African Americans is higher than any other group combined for all of the types of cancer. Now, that's a curious thing for me. How is it that something medical like cancer is affecting us more than everybody else? Let's talk some more about cancer. In 2009, African American women were 10% less likely to have been diagnosed with breast cancer. However, they were almost 40% more likely to die from breast cancer as compared to non-Hispanic whites. Does this make you sick? That's just cancer. Why is this happening with us? Let's talk a little bit about diabetes. African Americans are twice as likely to be diagnosed with diabetes as non-Hispanic whites. In addition, they're more likely to suffer complications from diabetes such as end-stage renal disease and lower extremity amputation. Although African Americans have the same or lower rates of high cholesterol as non-Hispanic white counterparts, they're more likely to have high blood pressure. And I had information about that, more information about diabetes. I have information like that about heart disease. It follows the same pattern. Information about HIV, AIDS, it follows the same pattern. For some reason, African Americans are dying and suffering from these kinds of diseases at a much higher rate than everyone else. Strokes, immunization, and infant mortality. Another thing with respect to children, we all know, and there's lots of research that connects makes a relationship between the connection between health care and access to health care in children and academic achievement. For example, we were talking earlier, for example, we have children that are being sent off to special ed because they're sitting in the back of the room and may not be able to hear or see. And so they can't see the board or they can't hear the instructions, and so very often they will act up in class. Or when someone says, Bobby, read this on the board, when Bobby can't read it because he can't see, then he's labeled as learning disabled and sent off to special ed. Not only that, some of our children, when they can't see and they don't feel good, as you said, the Affordable Care Act provides them with dental. Well, they need to have their grills fixed. And a lot of times when they don't feel good and they don't feel like they look good, of course, what do? They act up. And so what I want to do is I'm going to set the stage of this is not individual problems. These are problems that affect our community. If I act up in class, of course, she's going to act up too. And then he's going to act up and she's going to act up. And so because I don't feel good and I act up, I have the whole class acting up. And then the whole class is labeled as disabled and learning disabilities. And for some reason, African Americans don't seem to be able to learn. And so I just wanted to set the stage for how important this is. It's not just about getting individual cover for ourselves and our family, but this really has an impact on our community. This has an impact on our community with respect to how we thrive and how we survive. We have a lot of conversation in our organizations and our churches about how we survive. But one of the things that was left out in the past is about health care. Well, so now with the Affordable Care Act, we have access to affordable quality care. The other thing that I want to talk, and I wanted to keep on your mind again, that relationship between health care and education. That's a very, very important part. So let's talk again about our community. One of the things, as you mentioned, I've had the benefit of working with UCLA and Kaiser on electronic healthcare records. And so I've got a chance to get a peek into what are y'all doing? You know, particularly at UCLA. You know, what are y'all doing in Brentwood? What are y'all thinking about in Bel Air? You know, and so I've had an opportunity to work on that. And so let me tell you what they're thinking about. Some of these healthcare disparities that I was talking about before, these things are, and we all know about them, but for some reason we've just kind of taken them for granted and just accept them. You know, if you're a black man, you're going to have diabetes. You know, and I've talked to older black men, well, I got diabetes. Okay. Did you try not to? So? Well, I got diabetes. And it's like we accept that because we're black. I got hypertension. I got high blood pressure. Just because well, what I found out, what they are doing is electronic health care records is the ability for them to get data on people because they go to the hospital. So I want to put this together. We have affordable care. Okay, you guys with me on that? We have access now to affordable care. But in addition to that, we have access to go to the doctor. That's what that means. We have access now to be able to afford to go to the doctor and have ourselves checked and have records kept on our when we go to the doctor. Well, what happens, and what I've learned and what I'm teaching the people, the doctors and the other researchers at UCLA, is to use those records to figure out causes and preventions for some of those things that we just accept that we just have to have. So some of this, and for some of this, they know why we have this, but it's not up to them to tell us. Well, so what the Affordable Care Act provides our community is one, affordable care so that you and your family, you can take your children to the doctor. But it also is incumbent on us to get, what's included in that is preventative care. Very, very important for our community. We don't have to wait to get sick. We can go to the doctor, so it's incumbent on us again as leaders in our community to share that information with our community. That it's not just beneficial to us and for us to be proud that the African American president brought about Obamacare for us to sign up for it and for us to actually go to the doctor for preventative measures. Now, the sidebar for that is that as we're going to the doctor for preventative care and for maintenance, we're also getting records taken on us. And so researchers, and it has to be our researchers, they get that information and figure out why is it make relationships. What is it with our food that gives us diabetes and hypertension? But it could be more than our food. It could be the environment. It could be, as you pointed out, it could be stress. It could be a number of things. It could be a number of things that we don't even know until we get those records. So that's probably one of the most important elements of the Affordable Care Act that is getting right by us. In fact, the Affordable Care Act, I've had an opportunity, I don't know if you guys have seen it, but it's about this thick. A major part of it has to do with electronic healthcare records. And so when I got involved in this, it was because I wanted to talk about electronic healthcare records, but I realized quickly that that's not sexy. Nobody wants to talk about healthcare records, but we do want to talk about the Affordable Care Act. And so again, I'm putting it on us as leaders to make that connection. It's not just the Affordable Care Act, it's not just the preventative care, but it's also, there's a mandate for all hospitals and clinics. The clinics in our community, the doctor's office in our community are mandated by this act to have meaningful use software. And so when you go to the doctor, no longer the doctor just take your temperature and say you're okay, here's some pills, and let you go. They're supposed to have meaningful use software where they're keeping records of what happens. And when we get enough accumulative records in our community, we have the kind of data now that we can start to fix these discrepancies and these maladies that we have in our community that we heretofore have just accepted. So that was one of the things that I wanted to talk about. There's a lot, and as we get to the question and answer, I might be able to answer some of the questions with respect to the specifics of the Affordable Care Act. But what I wanted to make sure that we understand that it goes beyond just the Affordable Care is one. The second thing is preventative care. It's very, very important that we as leaders stress in our community that not only do you sign up for it, but you go, and that you take your children, and so that our children feel better, and so they're performing well in school. I was at a meeting a couple of days ago. Actually, I was doing some training, and one of the problems that someone said, well, you know what, Chris, with this Affordable Care Act, if everybody got to go to the doctors, we're going to have a shortage of doctors. That's a real problem. Oh, well, then let's talk to our young people about going in the health profession. If we're going to have a shortage of doctors, then that's the profession they need to look into. And so you see what I'm saying? But they can't go into medicine if they don't feel good. So there's a cycle of effect that we can have, and we can have our children feeling better, and then we can also stress the importance of education with respect to going in the healthcare field. So that was kind of, I'll kind of close mine with that. I hope I put some kind of things for you to think about. Is signing up. We must have our people sign up. We must have our people, and again, it's on us as leaders to be in our community, start with our relatives and our loved ones, and then talk with our community about they must sign up. Then, once we've signed up and it gets started, we must go to the doctor. Not only when we're sick, but we must use the benefits of preventative care, and a lot of the preventative care is free. So that's available to them, and it just warms my heart when I think about the number of people in our community that can now go to the doctor with preventative care and other kinds of services that are free, that till now we're out of the loop altogether. If you didn't have a job and coverage of your job, you were out. Well, now that's affordable to them. So it's important that we sign up, that we go to the doctor, that we take our children to the doctor for preventative care, and then it's important for some of us leaders to make sure that our clinicians in our community, and I love them, but make sure that they follow the mandate with respect to electronic healthcare records, that they know that they have to have it. But you know what happens in our community. I lived in Watts for a long time, and I know how some things could be going on somewhere else, and if ain't nobody watching, we might not do it. It's important. I'm going to be on the lookout. Now, I've already put something on notice. I'm going to find out, because I know what you're supposed to have. But it was for me, it was more important than for me to just do it. And that's why I wanted to go on a crusade to do these kind of town halls, to let others know that it's important that our clinicians, and the hospitals are doing it, but it's important that our clinicians have meaningful use software. They're supposed to have it, meaningful use software, and that they know how to use it. And then so if people are going to the doctor, they're gathering data, and then some of us and some of our young people that go into research, healthcare research, can then use that data to figure out and to solve some of these healthcare discrepancies that we have in our community. Thank you again, and we'll talk some more if we get to questions. I know that's not real sexy.